hospital survived and has grown up to be a healthy toddler. The other, taken to a hospital in Norwich, was left to die without any attempt to resuscitate.
Now her parents want to know why more wasn't done to help. Natalie Gray has this report.
Letitia and Robert Brown say they should be opening baby congratulation cards, not messages of sympathy. But here they are in Attleborough in Norfolk, just back from arranging their baby's funeral. Their daughter Alexis was born prematurely at 23 weeks, and they accused doctors of letting her die by refusing to treat her. She died 2 hours after arriving at the Norfolk and Norwich University Hospital, a hospital with one of the best neonatal intensive care units in the region.
We were both hysterical, screaming at them to try and help her. We've waited 5 years to have a child of our own. She was alive, she was breathing.
It should be done by case-by-case basis. If the baby comes out breathing perfectly fine, moving about, wriggling, then it should be given a chance to live.
The Brown story could not be more tragic or more different to another couple's experience in Milton Keynes. Their baby was also born at 23 weeks, but because he was breathing, doctors resuscitated. That baby is Nathan Skibaros, who's now 2. Born weighing just 680 grams, £1.08, he now has no health problems. His parents, Cara and Michael, named him Nathan because it means gift of God. For its part, the Norfolk and Norwich said it was following national guidelines not to resuscitate babies less than 24 weeks old. A spokesman said, sadly, Alexis was born very prematurely at home, and there was no question of survival in this case. Our midwives and doctors look at each case individually, but for babies of less than 24 weeks, the chances of survival are extremely remote. But Alexis's grandmother disagrees.
The baby was on her lap, still attached to her, kicking, waving her arms, making little noises, and how nurses and doctors who are supposed to save lives can actually physically watch that child die is beyond me.
The Browns are backing a campaign by Great Yarmouth mother Sarah Capewell, whose premature son Jaden died at 21 weeks and 5 days into her pregnancy. She petitioned the Prime Minister, calling for the guidelines to be scrapped. So 2 families, one with their whole future ahead of them, the other with their lives torn apart. And in a cruel twist, this couple may never get another chance to be parents again. Letitia had so much radiotherapy treatment for leukemia as a child. It was a miracle she got pregnant at all. Natalie Gray, Anglia News, Attleborough.
Extremely distressing. Now, well, earlier I spoke to the chief executive of Bliss, the charity for babies born prematurely, and began by asking if they feel clearer guidelines on resuscitation are needed.
I think the guidance as it's written is actually as clear as it needs to be for doctors who are faced with making very complex, multifaceted decisions, which aren't just based on the gestational age of the baby. There's also the weight of the baby, the condition of the baby, the medical problems that they may have, how the birth was and any trauma they may have had. And all of those are very complex, quite subtle, interrelated issues that doctors need to be able to take account of. What we are convinced of and clear about is that doctors and parents working together should be communicating openly and making sure that the right decisions are made for the best interests of the baby, and that should be done together.
It's terribly difficult to throw economics into a subject like resuscitation of babies, but when you hear of the fact that the NHS may have to lose 10% of its budget, do you feel that it's practical to resuscitate more and more babies?
Well, when we're talking about 23-week babies, such as we are today, there are only about 200 or so of those babies born every year, so really economics is not an issue. What is important is that all patients receive the best possible care that they can. Babies have no less right for that care than a child or an adult. So whether that is purely just a good quality clinical assessment at the beginning of life or full intensive care for many weeks or months, then babies have every right to that treatment too.
Andy Cole from Bliss, thank you very much for joining us this evening.
It's 5 years since London was rocked by a series of bomb attacks. 52 people died on the 7th of July 2005 and hundreds of others were injured.
But there were more victims that day, the local communities who then met with suspicion and mistrust. The attacks gave those who wanted to stir up hatred a perfect platform.
Well, a lot of hard work's been put in over the last 5 years to build bridges, and Neil Bradford's been finding out just how far we've come.
Just as they did 5 years ago today, commuters in Luton make their way to work, unaware of how the day will unfold. Now, just as then, they will board a train full of strangers. 5 years ago, those on the 740 to King's Cross could never have imagined that their fellow passengers included 4 suicide bombers. Although not deterred from travelling, there was still anxiety among this morning's commuters.
I was travelling the initial actual 77, so yeah, it was quite scary, and the effects did last for quite a while.
It's obviously something you still think about, but it's not a concern. You get on with it.
It's the anniversary again. I think that's made me feel a bit more, anxious, I guess, because you never quite know what's going to happen.
I'm not sure what we can do other than be as safe as possible.
Don't worry about terrorist attacks, but obviously it's something that you have to think about and feel for the families that lost their relatives during those attacks.
Shazid Tanweer, Mohammed Siddiq Khan, Hasib Hussain and Jermaine Lindsay from Aylesbury in Buckinghamshire were all captured on CCTV arriving at Luton Station. In the hours that followed, they murdered 52 people by detonating bombs on 3 tube trains and a bus. The days that followed were an anxious time for commuters right across the region, but in particular commuters from Luton who shared the train to London with the 4 bombers. But it was also an anxious time for community relations in Luton, which has a large Muslim population.
Community like Asian community, there was I would say, some kind of impact, and not just the Muslim community, even the non-Muslim community have suffered. Like, for example, the Sikh community, because they wear turban and they also have beard, and people mistaken them being Muslim and they have been targeted.
This is Diverse FM 102.8.
Luton radio station Diverse FM has a policy not to talk about religion or politics or the July 7 bombings. The station has played a vital role in promoting community cohesion since the attacks.
The community is much more stronger now from before, because community feel that yes, we all need to be together. There has to be some kind of a community cohesion, not divided. We all live side by side.
Today in London, a number of low-key ceremonies remembered the victims, 10 of them from our region. No one will ever forget the events of 5 years ago, but in Luton there's also a determination that the actions of a few fanatics will not destroy the spirit of such a multicultural town. Neil Bradford, Anglia News, Luton.
Well, it's almost 10 minutes past.